It's been a year since the first M-pox case was reported in the U.S. during a global outbreak. Now the CDC is worried about a possible resurgence of cases this summer. CNN's Mandy Gaither reports.
A new warning from the CDC about a potential risk for new cases of M-pox to surge this summer.
We're coming up on Pride Week right now when there are a lot of celebrations within our populations that are at highest risk for getting M-pox. And we don't want to see a month-long celebration turn into a tragedy.
M-pox is a viral disease that spreads through close contact. It can infect anyone, but in the 2022 outbreak, infections were mostly among men who have sex with men. Right now, a cluster of M-pox cases is being investigated in the Chicago area, where the CDC says there have been at least a dozen confirmed cases and one probable case reported between April 17th and May 5th. All the cases were among men between the ages of 24 and 46. All had symptoms, but none of the patients has been hospitalized. 9 of those 13 cases were among men who had received both doses of the 2-dose Jynneos M-pox vaccine. 4 of the men had recently traveled to New York, New Orleans, and Mexico.
We don't know how long the vaccination is going to provide immunity, nor do we know how long necessarily natural disease is going to provide immunity.
Dr. Kristen England with Cleveland Clinic says it's still important for those at highest risk of M-pox to be vaccinated.
For folks who have been vaccinated and still get M-pox, it is strongly suspected that the M-pox that they currently have is much less severe than it would have been if they had not gotten the vaccine.
I'm Mandy Gaither.